Hi, Dr. Gullberg here, continuing our internal medicine series. Today we're talking about fatigue. We see a ton of people with fatigue, both in the hospital and in the clinic setting. It's important that you have a differential diagnosis at your fingertips when you're talking to people about their fatigue. Be a good history taker and obviously do a very thorough physical examination. But these are some of the diseases that we need to be thinking about. And we group these into areas: muscle disease, metabolic disease, endocrine disease, cardiopulmonary disease, cancer, medications, and infection or inflammatory. Those are really the big causes. Now, in my experience, about 95% of fatigue is not related to a medical problem. It's more a mental issue such as depression, anxiety, or a sleep disturbance. But it's important that we rule out those 5% problems. So in terms of muscle nerve disease, we're thinking about myopathy. We're thinking about a myoneural junction disease such as myasthenia gravis. And then, of course, we're thinking about peripheral neuropathy or early MS or Parkinson's disease. So think about those. In terms of metabolic, malabsorption syndrome, anemia, any electrolyte imbalance affecting sodium, potassium, calcium, and magnesium, as well as chronic kidney disease or new liver disease. From an endocrine standpoint, we think about Cushing's disease, new onset diabetes, Addison's disease, hyper or hypothyroidism, and a low testosterone level, especially and obviously in men. Cardiopulmonary disease is more obvious: exacerbations of COPD, heart failure, or some type of arrhythmia such as sick sinus syndrome, obstructive sleep apnea in the pulmonary realm. Watch for cancer such as a paraneoplastic syndrome. That's very important. Med effects, so beta blockers, SSRIs, gabapentin. What's alcohol? Are they abusing alcohol or caffeine that's affecting sleep disturbance? Vasculitis such as PMR should be ruled out. And then, of course, chronic infections like TB, syphilis, HIV infection. That's certainly on the differential. So when we do a workup for fatigue, we're doing a CBC, we're doing a CMP, complete metabolic profile. We're checking thyroid function tests. We're checking ACH receptor blocker antibodies, CPK, cortisol levels, B12 levels, vitamin D levels. We're checking the urine, the ANA, the testosterone levels, HIV testing, CRP, SED rate, all very important. Preliminary sleep oximetry testing if you expect a potential problem with sleep, as well as EKG, echocardiogram, and chest x-ray. All very important in the making a diagnosis for what's causing a patient's fatigue. And of course, those medications need to be reviewed with them as well. So hopefully this gives you a good summary of preliminary workup of fatigue in your patients. Thanks, Dr. Gullberg, signing off.